Okay, here's my room 360. Okay.
Oh, I was gonna say you have a pen light.
I do have a pen light. Alright, I'm going out here. Knock, knock. Hi, my name is Riley. I'm going to be your student nurse today, performing hand hygiene and providing privacy. Can you verify your name and date of birth, please?
Pay Henning, 09/14/2004.
Perfect. And I checked out with her wristband and also in the MAR to have 2 forms of identification. And so today I'm going to be doing a full body assessment. So I'm going to start by assessing your nose, mouth, and throat. So to start off, your facial features are symmetrical. Your nose is symmetrical in midline with no deformities, lesions, or inflammation. And then I'm going to put on some gloves to palpate for sinuses. So I'm first going to start by palpating your lacrimal apparatus, so let me know if you feel any tenderness. You feel any tenderness?
No.
Okay, and there's no exudate from the lacrimal apparatus, and then I'm going to just palpate your upper lids, your lower lids, your eyebrows, and your bony orbit. Do you feel any tenderness?
No.
Okay, perfect. And then next I'm going to palpate along the bridge of the nose here. Did you feel any tenderness there?
No.
Perfect. So there's no tenderness along the bridge of the nose. And then I'm going to check the patency of your nostrils. So can you include one nostril and breathe in for me? Perfect. And do it on the same on the other side. Okay. So the nostrils are patent. And then next I'm going to look at the lips. So the lips are pink and moist with no cracking or lesions. And then I'm just going to have you open your mouth for me so I can look at the back of your throat. Okay. And then say ah for me. Perfect. Okay, the pharynx is pink and moist with no exudate or edema. The tonsils are pink and a grade 1, and the uvula is midline and rises with phonation. So that's good. And then I'm going to look in your mouth for one more time. Put the cheeks, okay, and under the tongue. All right, and then stick your tongue out for me. Okay, perfect. So the buccal mucosa and the floor of the mouth are pink, moist, and smooth, with no lesions, deformities, or growths. And the tongue is pink, even, and midline. And then next I'm going to have you smile for me, just so I can look at your teeth. And then kind of like this, so I can look at your gums. Perfect. Okay, so the teeth are white, straight, even, and evenly spaced and free of dental caries. And the gums are pink and the teeth adhere to the gums with no bleeding or discoloration. So everything looks good there. And next I'm going to move on to an eye and ear assessment. So in practice, I tested my patient's distant visual acuity using the Snellen chart. And the patient's visual acuity was 2013 in the right eye, 2015 in the left eye, and 2013 in both eyes, and without corrective lenses. And this tested cranial nerve 2. And then in practice, I also tested my patient's near visual acuity using the Rosenbaum chart, and my patient was able to read newsprint font 14 inches from their face without corrective lenses, and it's also tested cranial nerve 2. And then next I'm going to test your cardinal fields of gaze. So I'm just going to have you follow my pin light with your eyes without moving your head. Perfect. So the patient was able to follow all 6 cardinal fields of gaze with no nystagmus, and this tested cranial nerves 3, 4, and 6. And then next I'm just going to look at your eyes. So the, can you pull down on your lower lids for me? Okay, the conjunctiva is clear and pink. The sclera is white. The irises are brown with even color distribution, and the cornea is clear, bright, and smooth. The eyebrows are symmetrical and evenly distributed. The lashes are also symmetrical and evenly distributed and slightly curved outward. And the eyelids are intact with no redness or edema. So that looks good there. And then next I'm just going to measure your pupil size. Pupils are 5 millimeters in diameter. And then I'm just going to have you look at me. I'm going to shine this light in your eyes. Check your pupil constriction. Perfect. And then I'm going to have you look at my pen light. Look at the wall behind me. back of my pen light. Okay, and follow it in. Okay, perfect. So pupils are equal, round, reactive to light, and accommodation, meaning that perla is intact in this tested cranial nerve 3. And then next, I'm going to inspect the ears. So the ears are symmetrical, they're pink, there's no lesions. There's 2 piercings on one side and 1 piercing on the other. I'm going to look in your ear canals. Okay. All right, ear canals are clear. And then next I'm just going to palpate, so let me know if you feel any tenderness along your ears. I'm palpating the external ear, the tragus, and the mastoid process back here. And the tragus is like that right there. Was there any tenderness?
No.
Perfect, so no tenderness while palpating the ears. And then now I'm just going to do an auditory test. So I'll have you close your eyes and raise your hand on the side where you hear noise. Perfect. Auditory function is intact, and this tested cranial nerve 8. Okay, so now I'm going to do a skin assessment. So I'm looking at your skin. The skin is pink, is even in color distribution, and is consistent with ethnic backgrounds. It also appears to be clean, dry, and intact. I'm going to test skin turgor here. All right, skin turgor is less than 1 second. And then I'm going to palpate it. Okay, skin is smooth, warm, and firm. And then next I'm just going to measure a lesion on your arm. Okay. So this is symmetrical. It's even in borders. It's brown in uniform. It is 2 millimeters in diameter. Has this changed overall or at all? And it is not raised and there's no excudate, so it has not evolved. So that looks good there. And then next I'm going to take a look at your hair. I'm going to come around back here. So hair is brown. It is thick. It's straight. There are no bald spots, so it's evenly distributed. And then there are no parasites behind the ears or the nape of the neck. So that looks good. And then next I'm going to take a look at your nails. So the nails are pink, they are smooth, round, and slightly curved. Capillary refill is less than 2 seconds in the fingers. And in the toes, they are also pink, round, smooth, slightly curved. All right, and capillary refill is less than 2 seconds in the toes, so that looks good. And then I'm going to look at your neck. So the neck is symmetrical with no visible masses or scars. So it all looks good there. And then next I'm going to assess your heart and your neck vessels. So I'm just going to look at your neck. The carotid arteries are symmetrical and with no bulging noted. And then next I'm going to just listen to them with the bell of my stethoscope. So I'm just going to have you breathe in and hold your breath, and I'm going to listen to 3 different spots on each side. All right, hold your breath for me. Okay. I'll do the same on the other side. Okay, no carotid arteries are auscultated, and I'm just going to palpate them. All right, carotid arteries are smooth, regular, and +2 bilaterally. And the next I'm going to palpate your pericardium. So, I think I'm supposed to put the skin here, sorry. Okay, there are no pulsations, masses, or nodules palpated in the pericardium. And now I'm just going to take a listen to your heart. So I'm going to listen to all 5 areas on your heart with both my diaphragm and my bell. So I'm going to first start by listening to the aortic area, which is the 2nd intercostal space, the pulmonic in the 2nd intercostal space, herbs in the 3rd intercostal space, tricuspid in the 4th intercostal space, and mitral in the 5th intercostal space. I'm just gonna take a listen. Okay, and now I'm just gonna do the same thing with my bell. Okay, so S1 was heard loudest at the apex of the heart near the mitral area, and S2 was heard loudest at the base of the heart near the pulmonic area, and there were no murmurs or extra heart sounds noted. And then I would assess the apical pulse right over here, and I would take that for a full minute to assess the rate. And now I'm going to do a thoracic and lung assessment. So respirations appear even and breathing is unlabored, and I would assess the respiratory rate by counting it for 30 seconds and then multiplying it by 2. So right now patients' facial expressions are relaxed. Can you verify your name again for me?
Payhani.
Okay, and where are you?
Nursing annex.
Perfect. And what season?
Spring.
Perfect. Okay, so patient is alert and oriented to person, place, and time. And patient is also in an upright position with no tripoding when breathing. And then I'm going to assess your chest. So the chest appears elliptical and symmetrical. Okay, AP to transverse diameter is 1 to 2. And then go for ribs right there. Costal angle is less than 90 degrees. And I said the patient is upright and breathing with no tripoding. And there's also no cyanosis on the lips or the tip of the nose. And then next I'm just going to palpate across your chest. Okay. And then, oh, we have to turn around so I can turn. Yeah, thank you. I'm going to palpate down her spine. And then can you just breathe for me? Perfect. Did you feel any tenderness upon palpation?
Nope.
All right, so no tenderness or masses upon palpation, and the chest wall is stable. And then next I'm just going to take a listen. So I'm just going to have you take a deep breath every time you feel my stethoscope on your chest. And I can put it the wrong way. All right, perfect. And then you want to turn around for the back side. Thank you. Okay, perfect. So the lung sounds are clear to auscultation in all lobes bilaterally, anteriorly, and posteriorly. And I did not hear this, but if I were to hear adventitious breath sounds, they would be crackles or wheezes. Crackles can be fine or coarse. Fine crackles are a high-pitched popping sound, and wheezes are a high-pitched wail sound. And then next I'm going to do a peripheral vascular assessment. So again, I'm looking at the skin. The skin is pink, even in color distribution and consistent with ethnic background. I'm just going to palpate here. Temperature is warm. And then I'm gonna have you do this for me. Okay, there's no clubbing in the fingers, and then I'm gonna feel your arms. There's no edema in the arms. And then next I'm just going to assess some pulses on you. So I'm first gonna do the radial pulses. All right, radial pulses are smooth, regular, and +2 bilaterally. And then the brachial pulses. Brachial pulses are smooth, regular, and +2 bilaterally. And then next I'm gonna look at the legs. So the legs are symmetrical. There's even hair distribution. There's no varicosities and no ulcers present. And then I'm going to palpate your legs here. So the legs are warm. Was there any tenderness upon palpation?
Nope.
All right, no tenderness upon palpating the legs. And then I'm gonna assess for pretibial and malleolar edema. So, all right, there's no pretibial edema and there's no malleolar edema. So that's good. And then capillary refill, so less than 2 seconds. Okay, and then I'm gonna do this for myself, but next I would palpate for the femoral pulses, which are right here. And they are smooth, regular, and +2 bilaterally. And then I'm gonna do the popliteal pulses. I'm gonna have you, Okay. Popliteal pulses are smooth, regular, and +2 bilaterally. And then the posterior tibial pulses, smooth, regular, and +2 bilaterally. And then I'm gonna have you flex your big toes for me. I'm going like right here. You can see it. Okay, those are smooth, regular, and +2 bilaterally as well. So next I'm going to do an abdominal assessment. So I'll have you lay flat for me if you can. And I'm gonna move this a little bit. Okay, and then can you pull your, no. Okay, so the abdomen is flat and symmetrical. There is no inflammation or discoloration. Can you kind of bear down for me? All right, no hernias present, and there's also no visible aortic pulsations. And the skin is even and pink and smooth, and the umbilicus is midline and inverted. So that looks good there. And then next I am going to listen. So I'm going to start in the right lower quadrant and make like that type of shape on her abdomen. Okay. Vowel sounds are normal active in all 4 quadrants, and I would have to listen to each quadrant for 5 minutes to declare vowel sounds as absent. And then I'm also going to auscultate for an aortic bruit. All right, no aortic bruit was auscultated. And then next I'm going to palpate your abdomen. So do you feel any tenderness at all right now?
No.
Okay, so then I'm again going to start in the right lower quadrant over here. And I'm going to do a 2-finger circular motion. Was anything tender?
No.
Okay, there's no tenderness or masses upon palpation of the abdomen, and I would not do deep palpations because that is an advanced provider skill. And then lastly, I'm going to assess for CVA tenderness. So if you want to sit up and face that way for me, please. Okay, I'm just going to lightly tap on your back. So if you feel any tenderness, let me know. Do you feel any tenderness?
Nope.
All right, no CVA tenderness bilaterally. So that is good. And then lastly, I'm going to do a musculoskeletal assessment. So have you had any past surgical histories I should be aware of?
Nope.
Perfect. So today I'm going to be doing the shoulders and the hips. So I'm going to start with the shoulders. So the shoulders are symmetrical and there's no swelling or deformities noted. There's no masses or nodules, no increase in temperature. Do you feel any tenderness in your shoulders?
Nope.
Perfect. And then can you just give them a little move? All right, there's no crepitus in the shoulders either. So I'm gonna have you just perform the same exercises that I'm doing. So I'll have you raise your arms out for me. This is flexion, and then to the side is extension, and then behind you is hyperextension, and then we raise them up like this. This is abduction, and then they stick together, adduction, and then circle. This is circumduction. Okay, and then I'm just gonna apply some resistance now. So kind of do a shoulder shrug, push up on my hands, good, and then push up on my arms like this, good, and then push off on my arms, perfect. Okay, so there's active range of motion in the shoulders with +5 muscle strength bilaterally, and then I'm just gonna assess the same thing with your hips. So if you wanna lay back down in bed for me, please. Perfect, okay. So, I'm just gonna close all of it. Okay, so the hips are symmetrical again. There's no swelling or deformities, no increase in temperature, do not feel any masses or nodules. Do you feel any tenderness in your hips? Mm-mm. Okay. And then, can you move your hips for me? Perfect, so there's no crepitus in the hips. Okay, and now I'll have you do some similar activity or exercises. So I'll have you one at a time move your leg out for abduction, and then in for adduction, and the same on the outside. Abduction, adduction. And then I'll have you bend your knee and rotate it inward for inward rotation, like that, perfect. And then out for external rotation, and then do the same on the other side. Bend it in, inward, internal rotation, and then out is external rotation. And then I'll have you do circumduction on each legs again. So make a little circle, perfect, and then the other leg. Perfect. Okay, and then I'll have you push up on my legs. You can kind of do it one at a time if you want to. Perfect, and this one, perfect. And then I'll have you push out too. Perfect. Okay, so there was active range of motion in the hips with +5 muscle strength bilaterally as well. So everything looks good there. I'm just realizing now, I think I forgot to mention, but there was no guarding upon palpation of the abdomen. I don't know if I already said that. But thank you. I have finished my assessment with you. So I make sure that the patient is in a safe and comfortable position. I'll tuck you in. I'm gonna give her the call light. Do you have any questions for me? Okay, and then I'm gonna perform hand hygiene on the way out. And I would document my findings in the EHR tutor.